Dear friends, welcome to my YouTube channel. I'm Dr. Olena Berezovska. Very often people do not understand that pregnancy is a normal physiological state of a woman. This is a healthy state. Pregnancy is not a disease. But it is important to understand why the data on pregnancy is so distorted. Why is pregnancy perceived negatively, including by some medical doctors and midwives? Let's look at the definition of health, since many women are interested in the question of whether they can bear a pregnancy. This concept was adopted by World Health Organization in 1946. So health means a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This means that people may have some diseases that may be in remission and not bother these people. This does not mean that people must go through the permanent treatment. This also applies to pregnancy and a woman's health, because it is the female body that will carry the pregnancy for 9 months. This means that it is not necessary to be ideal health, almost a sterile state of the body, and the woman needs to get rid of all diseases. I'm surprised by cases when doctors force women to be treated for a very long time without serious indications. Sometimes such treatment is covered by the concept of just in case. Therefore, I'll tell you with confidence that in modern medicine there is no just in case indication. Any treatment, any intervention must be justified, that is, have indication. And this also applies to pregnancy, because a woman is responsible not only for herself but also for her unborn child. I understand that it's very difficult to make decisions when you know nothing about pregnancy. It is very difficult to deal with illiterate doctors and midwives. It is unfortunate that many tests are still compared with those of non-pregnant women. Pregnancy is a different universe. But let's talk about what can negatively affect pregnancy. What factors influence its course? How to limit yourself from these factors? I really like the biopsychosocial model of health, which was developed by the American physician and internist George Engel. This model was created in 1977. Even so, this model has been heavily criticized by doctors. I believe that Engel was the first to publicly state that the factors that affect a personal health are not only his internal factor, not only from the state of human body. He identified 3 groups of factors. I want to talk a little bit more about this fact. After watching this video, you will understand that you do not live on a desert island, but are surrounded by environment and people that can affect your health. You live in society, in a family, city or village. You are not alone, most likely. If you are a woman planning a pregnancy, you are in a relationship, and you may be working or studying, so you are surrounded by factors that can negatively affect your health and pregnancy. Therefore, even when we evaluate risk factors for complication of pregnancy, we must consider not only the health of the woman. So what affects health and pregnancy? I will equate health and pregnancy because factors that affect health affect pregnancy too. The first group is biological factors, which include heredity. Indeed, some diseases are inherited. We get half of chromosomes and genes from each parent. The set of chromosomes is called a karyotype, and the set of genes is a genotype. Each person has an individual set of genes, and we call it genetic feature, which is also a factor. Some breakdowns or mutation in genes and chromosomes can not only be transmitted from parents but also occur accidentally during conception. And this will determine our parameters, not only the external parameters of our body, but the parameters of our health. Thus, a genetic factor plays a very important role, and a genetic link is observed for many diseases. Another important factor is gender. Some diseases are more common in men, while others are more common in women. Men also don't get pregnant. The state of the body determines its health. Its parameters like low weight, high weight, obesity can have an impact on health and pregnancy. And of course, age. Age plays a very important role in conceiving a child and carrying a pregnancy. Now, many professional medical societies and associations have created guidelines for couples on conceiving a child. And according to these recommendations, the most optimal age for conceiving a child is 20-30 years old. And many will say, how so? I'm still in college or university. I'm not thinking about getting married and starting a family yet. Social needs in public views on the age of starting a family have changed a lot. However, this does not mean that our nature, biological needs are adjusted to our desire. Just from 20 to 30 years, the level of pregnancy complication is the lowest. And even there are not so much problem with conception, which often occurs after 30 years. Up to 60% of women over 30 will consult a doctor with complaints of problems conceiving a child. Also, these problems may not be significant. From 30 to 35 years of age, the aging process begins to increase, but still we can see a certain plateau or slight increase in age. During this period, morbidity levels also begin to rise slowly. But after the age of 35, more diseases appear and the level of pregnancy complications increase. All doctors know about it, or at least should know. At the same time, this does not mean that women under 20 or after 30 do not get pregnant and do not give birth. And not all women over 35 have problems with pregnancy. I will talk about age and pregnancy in another video. Age cannot be ignored. Also, you can hide behind a screen that at 40 I feel 18 or 20 or 25. I'm a hero, I go to the gym, lift heavy weights, gallop on a horse. Don't tell me I can't bear pregnancy. To be honest, I don't say that. But you need to be careful and sober-minded. Another group of factors that Engels described are psychological factors, which are often denied by doctors. These factors are important. If you notice, psychologists have become extremely popular. Now there are a lot of pseudo-psychologists, various gurus and bloggers who teach people how to live right. Every comes up with their own series, everyone offers their help, basically manipulating the wallets of their followers and making money on people who need psycho-emotional support. Thoughts, emotions, and behavior affect our health, our pregnancy too. Probably you have heard about the psychological factor of infertility, especially if you have read my books and other publications. This factor has really begun to be recognized in medicine. And this is not psychosomatics, which people also began to get involved in. It is very simple. Our negative emotions affect our health negatively. Pregnancy is a special psycho-emotional state when women worry about the child in the body. They become weeny, irritable, emotional. They can find fault with the words of partners. Their assessment of the situation is distorted. They can hate the whole world, at the same time love the whole world. Many pregnant women know that they cannot watch horror movies, violent movies. They begin to cry. Some women cry at the sight of children or children suffering. It is true that pregnant women are more emotionally vulnerable. This state can and should be controlled, at least partially, because a person in fear ceases to analyze the situation normally. In a state of fear and anxiety, people make mistakes and can harm themselves and others. Do you know what is the most common question I get from women planning a pregnancy? As soon as she takes a pregnancy test and receives a positive result, a woman begins to rush about what to do, where to run, what tests should be done, and instead of positive emotions, almost panic and fear. But why are you in such a hurry? And I say such women, please calm down, relax. With your negative state, you will harm your pregnancy more than you think. You will still have time to go to the clinic and do a lot of tests. If you have no complaints, no bleeding and pain, there is no need to run anywhere. You must be happy about your pregnancy. Enjoy your new state. Thus, the psycho-emotional factor plays a very important role in health and pregnancy. Several studies have been conducted to determine the effect of a stress factor on a course and outcome of pregnancy. High levels of stress have been found to be associated with early pregnancy loss and preterm birth. And the third important group of factors is social factors. These factors were also denied for a long period of time, including by doctors. But after all, a woman lives in a family, she has a relationship with a partner, husband, father of the unborn child, she works or studies, she communicates with other people. It is influenced by culture, ethnicity, religion, society, and the environment. Different people of the world have their own views on pregnancy and women's health. I will not even mention environmental factors, but living and working conditions also affect health and pregnancy. And it's worth mentioning the food, nutrition. But if we talk about social factors in general, the public opinion and opinion of other people can put a lot of pressure on decision making. In some regions of the world, women often face imposed dogmas and prohibitions, obstetrical aggression, and violence. A lot of money can be made from a pregnant woman, especially through intimidation, and this is used by many doctors in countries where their actions are not controlled. Under the influence of intimidation, women make mistakes, sometimes fatal. And having lost a pregnancy or child, they again hear accusations that this is their fault. Unfortunately, in addition to obstetric aggression and abuse, there is reproductive aggression, including from relatives and friends. There are different types of abuse: verbal, physical, sexual, financial, religious, and others. Therefore, I can safely say that everything in life is interconnected and everything can affect health and pregnancy. We will continue the theme of pregnancy in my other videos. Don't forget to press like and subscribe to my channel and write comments. See you next time.